Let's go ahead and pull up the numbers, Ellie, first, and we'll go through those, and then we'll talk about some of the other issues we're facing right now. Thank you. Perfect. So as you can see here, the death toll has gone up. It's something that certainly we were hoping to avoid, but unfortunately, we saw 3 earlier this week and 1 more. So we've gone from 117 to, we've gone to 118 now with 4 new ones from 114 previously reported last week. And we had gone for a period of time without a death, and but this disease continues to march on and impacts people, but certainly something that we had hoped to avoid. As you can see, the total cases now are at 5,306, and you can see the populations that are impacted there. A lot of the younger population still impacted, and then exponentially. The people impacted here by race are Hispanic, and we'll talk a little about that in later on in this presentation about what we're doing about that, and some more information on the disputes. Really, an article that was came out earlier in the week. So let's go to the next slide. So you can see the hospitalizations here are at 70, with 63 confirmed and 7 suspected. Out of county patients are at 8, with look like 13% of the total population. Let's go ahead and go to the next slide. And just if we can back up a second, as you can see, in regard to the beds availability and the surge space and all that remains good for us. We're in good shape there, and that plays into something I'll talk about later on. Positivity rate has inched up to 5.2. We'd like to see that below 5, and we had it, I believe, last week down at 4.8. But we've really crossed a milestone here at over 100,000 tested in the county, which is remarkable in the period of time and with the limitations we've had in effect. And you can see the average daily result turnaround is 2.39 days, but that really depends, I think, on where you're getting tested. And I've heard anecdotally, tests taking up to 10 days, which doesn't really bode well for us being able to track and trace and do all the things necessary to stop the spread of the disease. And that's why that turnaround time is so important. And in part, why the restriction of 500 a day has been placed on Verily, and they are adhering to that, though they are still taking all that seek to be tested. Go to the next slide. So you can see San Mateo remains the leader in the county. Well, I think with Redwood City, I think if you added up all of San Mateo, they are leading, with Redwood City close by. Next slide. And you can see that the hospitalizations remain at with our long-term care facility data, hospitalizations are at 95, and the deaths are at 78. So clearly, that's an area that's been overwhelmingly impacted. So let's talk a little bit about where we are with some of our other statistics. We have 28 at the ACS in Burlingame, and that is the most we've had in a long time. And we're moving to close down the facility and go to a more room-based model, so we're not paying an exorbitant cost of operating an entire hotel for the entire month. But we still have that feature available for those who need to isolate or are on recovering from a COVID-19, but not yet able to be cleared to go home. We have 89 guests at the AHS Bayfront Station, with another 93 guests and other homeless utilizing other hotel rooms around the county, for a total of 182 served. Verily continues to do a great job for us. They've last week completed almost 2,300 tests, 2,297. Of those, 287 were walk-ups. Average no-show rate is 10.8%. And this was the first week that the county was subjected to that 500 cap with Verily sites. So you'll see those numbers come down, and we're worried about how that will impact the positivity rate. The testing criteria by Verily remains unchanged, and Verily is really awaiting direction by the state's testing task force before making any of those changes that we've talked about in the past. Certainly, we've done a great job in working with the cities and utilizing volunteers at the various sites as we moved Verily around to different locations. So I wanted to address a little bit now some of the concerns the media raised that the testing in San Mateo County isn't sufficiently targeted to low-income communities, including farm workers. And I think that when you really look at the facts of this and where we're at right now, that is just not the case. So the county is certainly aware of disparities in access to healthcare and testing, and continues to advocate for and explore additional testing resources for our underserved communities. And I think in the coming weeks, we're going to roll out a new strategy that will really enhance our abilities to reach those targeted communities. And but going back to what we've done in the past, this is in large part, why we started moving Verily around in mid-May to better provide better access to residents across our county, including low-income communities and community of colors. And I wanted to say this, and this is something we're very proud of. We are the only county in California that has invested the needed resources to rotate Verily in an operation to multiple county sites. The only one in the state of California who's done that. And really that's been dependent upon volunteers. The cities have really stepped up and provided volunteers. We have used our employee resources to operate those sites. And as a result of that, we've performed over 24,000 tests since we started rotating Verily, including 5,600 plus in Daly City and in San Bruno, and another 4,300 plus in East Palo Alto, and 2,000 in Half Moon Bay, and another 3,300 in North Fair Oaks. Certainly we've requested additional state resources, but we have not received those resources. We'd love to have additional resources from the states to help us with that. In addition to community test sites, the counties prioritize responsive testing efforts such as small field testing teams who are closely tied to contact tracing and deployed on short notice anywhere in the county. And we've seen this in an apartment complex where we went out, we saw a little bit of a spike in that apartment complex. We went out and tested the entire complex of 800 folks within 3 hours. And we have the capability of doing that. And we'll talk about in the future different strategies we're going to employ to expand upon that. And then just a reminder to everyone also is that testing availability through healthcare providers is a key source of testing in our county. 96% of our residents have some form of health insurance, including Medi-Cal and ACE and health plans that cover testing at no cost to their members. So the article highlighted the needs of the farm workers, infections among the farm worker population statewide, but we have not seen that. Certainly we're sensitive to that, but we have not seen that in our farm workers, and that's why we did testing in Pescadero, and we continue to do testing in Half Moon Bay. And we certainly continue to work with our partners in those communities to make sure that that we're not missing something, and that we provide those resources that are necessary to determine if there's an issue there. And as of yet, we have not seen that. But that's something that's very important to us. And we don't certainly want to criticize that article, but there are certain facts that were left out of that article that I think are very, very important to what we're doing here in this county in regard to testing. So I'm sure all of you, now switching gears to another topic, I'm sure all of you are aware that San Mateo County was informed last night that we've been put on the 3-day active engagement list, really the state's watch list. And that's the phase that precedes us moving to really the additional restrictions that the governor put in place on July 13th. That will take effect as of, I believe, midnight this Friday, if I'm correct, and that will have certain implications, further restrictions that we'll have to adhere to in the areas of gyms and fitness centers closing, places of worship, indoor protests, offices for critical infrastructure in sectors as identified in that covid19.ca.gov. Personal care services, including hair, nail salons, massage parlors, tattoo parlors, hair salons, and barbershops, and malls. And I just want to say this in regard to that. We believe it's unwarranted at this point in time, and that there needs to be a more surgical approach to these shutdowns than we're seeing here. These are widespread blanket closures of businesses that we can't tie back to the spread of COVID-19. We believe that we know where the disease is spreading, and we're taking steps to deal with that and to really target our resources towards that. We believe that the spread in this county's somewhat normalized and certainly something that we've expected and is not a surprise and has not overwhelmed us. We believe the hospitalizations are something that certainly that we can continue to work with, and that they're not overwhelming us at this point in time. So, we will continue to advocate on the part of this county that we don't believe that that this is warranted. Over the next several days, we'll have discussions with the state and point out why numbers can be changed when you're dealing with small numbers, and they're changed by a small percentage, how that can skew things and skew those percentages. So it's something that we're certainly willing to talk about and address with the state, and hopefully they'll see it our way. And if not, we will be on the watch list by Saturday, and those provisions will go into effect in this county. So with that, we'll go ahead and open it up for questions.
First hand raised here is Henrietta Burrows. You've been unmuted.
Thank you.
Henrietta, how are you?
Oh, I am fine, and I hope everyone your way is fine too.
Great, thank you.
Thank you. Since the county is so close to being on the watch list, has there been any consideration of the idea of fining residents if they don't wear masks?
Well, one point of clarity is that I think we're actually, maybe it's technical in nature, we are on the watch list now, and there's a 3-day period of active engagement. So I believe we are actually on the watch list now, but it doesn't come into effect until after that 3-day period, which would be early Saturday morning. Henrietta, it's a good question. We have talked about this in the past. Really, we're relying upon the good nature of everyone in this county to adhere to the requirements of wearing a mask when out in public. And for the most part, I'm around the county like all of you. I see most people adhering to that, but we are launching an extensive media campaign to make sure that people understand that we're all in this together, and it's going to really depend on all of us, our comeback, and we all have to do our part. That we've worked hard to get to this point, and we're going to need to continue to work hard to make sure that it does not spread, and that we continue to wear those masks and socially distance and wash our hands, and do all the things that we would expect anyone in our society to do to protect not only themselves but the lives of others in this county. So that is something we continue to do. But the question becomes, and your point's well taken, if we do that, like we've seen before in other counties, who enforces that, and what resources are we going to use to do that? So, I'm at this point in time, I'm certainly not going to say it's not impossible that would occur in the future, but I don't think that we're headed that direction right now.
Okay, thank you.
And just as a reminder, if anyone has a question, you can either type it into the chat box or raise your hand by clicking the participant icon at the bottom of your screen. A window will pop up and you should see a raised hand button there. And Sierra Lopez, you've been unmuted.
Hi, yeah, thank you. I believe we submitted a list of questions earlier, but that might have gotten lost.
I'm sorry. I'm working remote, Sierra, so that very well could be the case.
No, definitely okay. Thank you. So can we get some clarification then on whether businesses will have to begin closing at any point between now and Saturday? So then all those closures will begin Saturday? Is that what I'm supposed to understand?
I'll let David, who's on the line, David Silverman from County Council, who's on the line, address that specifically. But my belief is they'll have to close as of early Saturday morning. But David, you're the expert.
That's right. I mean, again, this assumes that we remain on the monitoring list for 3 days, which we do assume, but we remain hopeful. If we remain on the monitoring list for the next 3 days, then at 12:01 on Saturday morning, August 1st, those new businesses must cease indoor operations.
Right. And Sarah, like I said before, we still are engaged in the state. We're still going to have dialogue with the state, and we hope that when we prevail upon them, they'll listen to us and maybe change their mind. But we'll see.
I mean, I think the key.
Go ahead, David.
I'm sorry, Mike. I was just going to say, I think that the key is that businesses should prepare. We always hope for the best, but prepare for the worst.
Right. Good point.
Okay. So then there is a possibility that we could be removed from the watch list. What kind of measures would community members and county officials have to take to get us off of the watch list before Saturday?
Well, I think there needs to be there's an ongoing dialogue, and Sreeja, maybe you're best to talk about some of those things that we're talking to the state about.
Well, we really appreciate that the state would like to hear what our on-the-ground perspective is and what the health officer sees and what we see in our local epidemiology. Our case rate, the metric that puts us over the threshold, is a 14-day average. And we're part of a regional ecosystem, so the state has been looking at that. At the same time, there is dialogue with public health officials across the state about the metrics, what's really meaningful. And what the health officer has continued to reinforce are, what are the things that would be most effective given what we see as the root cause of the spread? And what we see is the need for reinforcement of those core behaviors, avoiding gatherings, facial coverings, and then the deeper issues around people whose work situation doesn't protect them enough from the spread, people whose housing situation doesn't protect them enough from the spread. And so the sector specific isn't as aligned with what we see as the core issues locally.
Okay.
Is there anything else?
Yeah, so then with these, what would these closures then mean for, at school, in-person learning for our students countywide?
Right. So the governor also directed that schools in counties on which who's on the watch list cannot open in person at the middle or high school levels until 14 days after being taken off the monitoring list. So certainly there would be an impact there.
Any other questions, Sierra?
I'm double checking over my list, but if anyone else has any other questions.
Great. So I'll go ahead and lower your hand for now. Henrietta has her hand raised.
Mike, can I clarify something you just said?
Yeah, because there is an exemption there.
Yeah, that's what I was just going to note. So elementary schools that choose to can seek an exemption from the health officer that would allow them, elementary school districts, to offer some in-person learning. High school districts cannot provide in-person learning for at least 14 days after we're removed from the monitoring list.
Right. And Henrietta, let me also say back to your question, because David just reminded me that certainly it is a criminal act not to wear a mask now in violation of the state order, or which we've adopted at the local level also. So someone could be charged with a violation as it exists now. It's a misdemeanor. So to the extent I know that others counties have taken steps to institute fines instead of that. I mean, that could be the case in the future. But it's not the case right now.
You had mentioned disproportionate incidents among the Latino population of the coronavirus. And I think you said you were going to make a few remarks about the high incidence. Did I miss those remarks?
Well, I did. I talked really about the Chronicle article and a lot of the information that I felt was left out about the fact that we are moving our test sites all around the county, and we're one of the few that have we're actually the only one who has done that with the Verily sites, where we're staffing and moving them around. We've also engaged in an extensive communication program with our Latino and Hispanic communities, and we continue to do that. In addition, we're looking at strategies that will really address some of the underlying causes of folks feeling that maybe are sick and feel that they have to go to work, in addressing a living wage and a place for them to separate from their family and isolate for a period of time. So that, along with the extensive testing that we've done, the isolated testing, the ability for us to go in and test certain communities quickly and to deploy resources to those specific census tracts if we have to address a spike, and our ability that we've engaged in the requirements, and it will exceed the requirements for contact tracing. All those are things that we're utilizing, along with the direct marketing, in a mass mobile that we're going to put out there and distributing mass to the community. We're going to target these areas where they're hard to reach and maybe not getting the messaging, but we're going to work with store owners that are open, and make sure that they adhere to the requirements and that the message gets to everyone. So we have done a lot on this front, and I think that was not really addressed in that article.
Okay, thank you.
At this time, I don't see any other. Actually, Sierra has her hand raised again. Go ahead, Sierra.
There you go. Yeah, hi. Thank you for the additional question. I'm interested in if we have any information on the 4 additional deaths, if we know, demographics around their age and race at this time.
Sarija, do you have any of that information?
Sorry, getting myself off mute. It's a cumulative total that our website updates. I believe all 4 of the additional deaths reported in the last week were over the age of 80. I could confirm that if that's a fact you want me to confirm, Sierra.
Yeah, I figured that everything would.
Yeah, I'm just interested in where they kind of fit into the demographics, but it kind of looks online that that's probably accurate as well.
Yeah, former cop.
Great. Any other questions?
Yeah. I know, it's a story. Yeah.
All right.
That's for me. Thanks.
Great. Thank you all for being with us. We really appreciate it. And certainly we'll have more information in a press release if things don't change by early Saturday morning. Just thank you for all you're doing. Stay safe out there, and we'll see you next Wednesday. Take care.